Auvelity is a prescription medicine used to treat a certain type of depression called Major Depressive Disorder in adults. Auvelity is not approved for uses other than the treatment of MDD. The ingredients in Auvelity, bupropion and dextromethorphan, are the same ingredients found in some other medicines approved for other uses. Who should not take Auvelity? Do not take Auvelity if you have or had a seizure disorder, have or had an eating disorder such as anorexia, nervosa, or bulimia, have recently suddenly stopped drinking alcohol or use medicines called benzodiazepines, barbiturates, or anti-seizure medicines, and you have recently suddenly stopped taking them. Take a monoamine oxidase inhibitor. Have stopped taking a monoamine oxidase inhibitor in the last 14 days. Are being treated with antibiotic linezolid or intravenous methylene blue. Are allergic to dextromethorphan, bupropion, or any of the other ingredients. Dosing information. Usual adult dose for Auvelity: 1 tablet once daily in the morning for 3 days, then increase to the maximum recommended dosage of 1 tablet twice daily, separated by at least 8 hours. Each extended release tablet contains dextromethorphan hydrobromide 45 mg and bupropion hydrochloride 105 mg. Prior to initiating treatment with Auvelity, assess blood pressure, screen patients for a history of bipolar disorder, mania, or hypomania, and determine if patients are receiving any other medications that contain bupropion or dextromethorphan. What should I avoid while taking Auvelity? Limit or avoid using alcohol during treatment. If you usually drink a lot of alcohol, talk with your healthcare provider before suddenly stopping. If you suddenly stop drinking alcohol, you may increase your chance of having seizures. Do not drive a car or use heavy machinery until you know how Auvelity affects you. Auvelity can affect your ability to do these things safely. What other drugs will affect Auvelity? Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Auvelity and some other medicines may affect each other, causing possible serious side effects. Auvelity may affect the way other medicines work, and other medicines may affect the way Auvelity works. Adverse reactions. Most common adverse reactions: dizziness, headache, diarrhea, somnolence, dry mouth, sexual dysfunction, and hyperhidrosis.